Welcome to Chapter 8, Lifespan Development, Emergency Care 14th Edition. So we're going to talk about lifespan from birth to death, basically. Infancy is birth to 1 year. The physiological changes occur that are 6.5 to 7.5 pounds at birth. That weight doubles by 6 months and then triples by 12 months. The head is 25% of their total body weight. Their airway is more narrow, shorter, and more easily obstructed. Their nose and diaphragm are used for breathing. These kids are belly breathers. Antibodies are passed from mom to child during pregnancy and also through breastfeeding. They have a Moro reflex, which is that startle. They throw their arms out, spread their fingers, and then grab with their fingers and arms. They have a palmar reflex, grasps objects when placed in the palm. They also have a rooting reflex. They turn their head to the side when their cheek is touched. And they have a sucking reflex, sucks when lips are stroked. Sleep patterns. Usually initially sleep 16 to 8 hours throughout the day and night. This soon changes to 4 to 6 during the day and 9 to 10 at night. And by 2 to 4 months, will sleep through the night. If only that were true. Extremities grow in length from a combination of growth plates at both ends of the long bones. Their fontanelles are not fused at birth, so they have a posterior fontanelle that closes in 2 to 3 months and an anterior fontanelle that closes in 9 to 18 months. The fontanelle is the little soft spot on a baby's head at the top of the head. So the posterior closes in 2 to 3, anterior 9 to 18. If they have sunken fontanelles, that indicates dehydration, and if they have bulging without crying, it can indicate increased pressure inside the skull. Psychosocial, they will bond. They have a sense that needs to be met. Trust versus mistrust. They have a desire for an orderly, predictable environment. They scaffolding, so they start scaffolding, which is where they learn by building on what is already known. They learn that this is mom, she gives me what I need, and we build from there. Temperament is a reaction to their environment. Vital signs for these kiddos is here. Their heart rate is 100 to 179. Respiratory rate is 0 to 6 months, 30 to 60 a minute, and 6 to 12 months is 24 to 30 a minute. Respiratory volume for these kiddos is at birth 7 to 8 mLs per kilogram, and after 1 year it turns into 10 to 15 mLs per kilogram. Their systolic blood pressure from 0 to 6 months is 50 to 70, and after about a year it goes up to about 90 millimeters of mercury. Toddler phase is 12 to 36 months. Their physiological changes, they have body temperature ranging from 98.6 to 99.6. Their weight gain will be about 4.4 pounds per year, and their body systems start to improve in efficiency. Their pulmonary system starts to branch off and grow. The alveoli increase in number. Their nervous system, the brain is 90% of an adult brain weight. Their fine motor skills develop, and their muscle mass and bone density also increase. They are more susceptible to illness. Their immunity develops through exposure and vaccination. They start to get all their primary teeth, and they come in by 36 months, typically. Toilet training is physically possible at 12 to 15 months, but not psychologically possible until 18 to 30 months. In their psychosocial phase, they begin to understand that words have meaning. They understand cause and effect. They develop separation anxiety. They also begin to develop magic thinking and engage in play acting. And then they start to master the language basics that are then refined through childhood. Their vital signs include a heart rate of 80 to 140 a minute, respiratory rate of 24 to 30, and a systolic blood pressure of 90. When you talk about kids, you actually talk about a formula to get their systolic blood pressure. So it's 90 times the plus age times 2. So if they are 10 years old, so 10 times 2 is 20, plus 90 is 110. So their a 10-year-old's blood pressure would be systolic, would be 110. Preschool age is 3 to 5. Body systems continue to develop. They're psychosocial. They become more interactive, and their social skills develop. Peer groups provide information about other families and the outside world. And that peer interaction offers opportunity for learning, making comparisons, and being part of a group. Their vital signs include a heart rate of 70 to 120 a minute, respiratory rate of 22 to 34, and again, when we talk about these kids, that formula. School age is 6 to 12. Their body temperature starts to range from 98.6 to 101.3. Their weight gain will be about 6.6 pounds per year. Their growth will be about 2.4 inches per year, and their primary teeth will be shed and replaced by permanent teeth. In their psychosocial development, the parents spend less time with the child and provide general supervision. They start developing skills for decision making. Their self-esteem develops and is affected by popularity, rejection, and emotional support and neglect. Their moral development begins based on rewards and punishment for behaviors, and their moral reasoning appears and control of behavior shifts to internal sources. Vital signs again, 65 to 120 a minute for heart rate, respiratory rates so 18 to 30, and again, systolic blood pressure is that formula. Adolescence is 13 to 18 years. They have a rapid 2 to 3 year growth spurt that begins with growth of hands and feet, and then arms and legs. Their sexual maturity is reached and secondary sexual development occurs. In their psychosocial development, they strive for independence and individual identity. Their interest in sex develops. Their body image becomes a concern, and they may be prone to more self-destructive behaviors, and their personal code of ethics develops. I like to call these kids the I can do anything type of kids, especially for the boys, the ages of 17 to about 24, because their cognitive reasoning skills have not fully developed. And when they're in this age range, they think that they can do anything. They think that they cannot be hurt by anything. They typically die of some type of trauma. Heart rate is 60 to 100 a minute. Respiratory rates 12 to 20. And then their systolic blood pressure is 107 to 117. Here we start to see where these kids start to kind of normalize out on their vital signs. And when I talk about normal, I compare that to an adult vital signs. Early adulthood is 19 to 40. Their physiological changes include lifelong habits that are formed, and they are in peak condition that occurs between 19 and 26. They have psychosocial development changes such as job, family, and stress levels are high. Their marriage, childbirth, and child rearing often occur, and accidents are their leading cause of death. Again, it's that I can do whatever I want without repercussion type stage. Their heart rate starts to begin to, their vital signs start to begin to normalize again. 60 to 100. Respiratory rate is 12 to 20. And their systolic blood pressure is usually less than 120. Middle adulthood is that 40 to 60 age range. Physiological changes include they have no significant changes in vital signs. Their vision correction may be needed. They develop cancer, high cholesterol, and heart disease. Weight control becomes more difficult, and menopause may begin for women. Psychosocial development for this age group, they have task orientation that increases. Their problems are viewed as challenges rather than threats. They also may have empty nest syndrome and is concerned about both adult children and elderly parents. Vital signs, again, not going to change a whole lot from that early adult range. Late adulthood, their vital signs depend on their health and physical condition. Their cardiovascular system is less efficient and blood volume decreases. Their respiratory system deteriorates and increases the likelihood of respiratory disorders. Endocrine changes decrease metabolism. Their sleep and wake cycle is disrupted, and other body systems deteriorate as time goes on. These people, basically what's happening is their body is just degrading or deteriorating. So their skin tone, their muscle tone, their blood vessel tone, their heart, all of these things start to weaken and do not work as efficiently as they once did. Psychosocial development, they face many challenges, including a living environment, self-worth, financial burdens, death and dying. Their motivation, personal interest, and activity can enhance in late adulthood. Their vital signs are not going to change unless there is some type of disorder or disease process going on in their body. Sometimes it can go higher, sometimes it can go lower. Just kind of depends on where they are physically.